Oral Health Care Skills Web Series number 7, Oral Hygiene Care Plan. I am your facilitator, Mary Lou Vanderhorst, from the Regional Geriatric Program Central in Hamilton, Ontario. I would like to welcome the presenter, Donna Bowes, from the Halton Region Health Department in Oakville, Ontario. Hello. And knowledge broker, Terry Kirkpatrick, from the Seniors Health Research Transfer Network in Ottawa, Ontario.
Hello.
We ask that you note several items. First, no photos in this presentation may be copied, but permissions may be requested. Secondly, this is an educational presentation to be used for learning purposes, and users of this information are responsible for adaptation of this information to their practice and work environment. We have made every effort to provide you with accurate, evidence-based, and useful information. Finally, we thank Sherton, Halton Region, and RGPC for their contributions to make possible the Oral Health Care Skills web series. Donna Bowes will now present Series 7, Oral Hygiene Care Planning.
Ideally, all residents in long-term care should have a complete oral health examination by a qualified oral health professional upon admission, and then on a regular basis thereafter. Best practice indicates that these examinations should be supplemented with oral health assessments and screenings by trained caregivers using validated tools, preferably those created for use with frail older adults and those with functional and cognitive challenges. OHAT, or Oral Health Assessment Tool. The Oral Health Assessment Tool was featured in the RNAO Nursing Best Practice Guideline Oral Health Nursing Assessment and Interventions 2008. This tool guides the assessor through a number of categories in order to ensure a comprehensive assessment is conducted. It also provides guidance with regard to the action required when changes are observed. It is recommended that an oral hygiene care plan be developed concurrent with the completion of the oral health assessment. The OHAT can provide some of the baseline information required for the oral hygiene care plan. The follow-up section at the bottom of the OHAT provides a reminder that an oral hygiene care plan indeed needs to be completed. It makes sense then that the two tools would be used together. Ideally, the assessor should not be the same person that provides the daily oral care. There is value in having a different care person doing the OHAT and developing the oral hygiene care plan. That second set of eyes will often observe things through a different lens, and these observations lead to fruitful discussion and optimal care planning. Oral Hygiene Care Plan. This oral hygiene care plan was adapted from Chalmers' 2004 validated instrument. The top left, or assessment section, can be completed using information collected during the oral health assessment, but it is recommended that the two be completed concurrently since the oral hygiene care plan collects more specific information. The top right, or interventions area, may require some input from a dental professional and will most certainly draw on knowledge provided by the resident's daily care providers. So the assessor may not be able to complete the entire form during the oral health assessment, but may indeed have to finish up later once there is time for further consultation. The lower portion of the plan outlining the barriers must be completed with input from the caregivers who work regularly with the resident. One of the benefits of working through a comprehensive oral hygiene care plan is that it encourages assessors and caregivers to discuss and problem solve together. A copy of the completed plan can be posted in the resident's bathroom as well as included in the chart. We will now look at translating information from the oral health assessment tool to the oral hygiene care plan. As each category in the OHAT is reviewed when conducting the assessment, the outcome can serve as an indicator to help develop the oral hygiene care plan. The assessor will need to consider the implications of the Level 1 changes and any recommended interventions to ensure that this information is then translated to the oral hygiene care plan as appropriate. The observations from the first categories of the OHAT, that is lips, tongue, gums, and tissues, and saliva, can be translated to either the general section diagram of the care plan and or the interventions for oral hygiene care section. The assessment of natural teeth and dentures will be covered in the next slide. Oral cleanliness is another category in the OHAT that will lead the assessor to make recommendations under the interventions for oral hygiene care section of the oral hygiene care plan. The dental pain category of the OHAT and the regular barriers in the care plan are intertwined. Dental pain will usually result in responsive behaviors, particularly for residents with dementia. In this slide, the oral hygiene care plan has been superimposed over the OHAT to try to demonstrate the application of the OHAT category findings to the oral hygiene care plan. As an example, the first category in the OHAT is lip. If you have a level 1 finding, that is dry, chapped, or red areas at the corners of the mouth, the intervention would be to use lanolin, KY jelly, or other non-petroleum-based lip lubricant. This information would be entered under the Interventions for Oral Hygiene Care section in the upper right under the Other box. If there are splits at the corners of the mouth, you may wish to indicate specific areas on the diagram under the Assessment of Natural Teeth and Tissues so that caregivers are reminded to monitor for changes. An example will be shown in slide 13. For the tongue, for example, a level 1 finding, patchy, fissured, red, or coated tongue, would be information that you might wish to note on the diagram under the Assessment of Natural Teeth and Tissues, as well as under Interventions for Oral Hygiene Care at the top of the middle box. You would tick brush, mouth tissues, and tongue and indicate both AM and PM. Gums and tissues, brush, mouth tissues, and tongue, both AM and PM, are pretty much standard procedure. If the assessor notices anything in particular that caregivers should be aware of, it can be recorded on the diagram under the Assessment of Natural Teeth and Tissues. For saliva, dry, sticky tissues are an indicator that dry mouth products are needed. This is recorded under Interventions for Oral Hygiene Care, indicating the dry mouth products. The category of natural teeth and the one for dentures are quite simplistic for OHAT, but you will need to record a bit more complicated information for the oral hygiene care plan under the Assessment of Natural Teeth and Tissues and or Assessment of Dentures. We will look at an example to give you an idea of what this would entail. In this photograph, you see a client with some upper teeth as well as 2 root tips, which are highlighted with the yellow arrows. This information needs to be translated to the oral hygiene care plan in the upper left section of the tool under Assessment of Natural Teeth and Tissues. Under upper, the assessor would circle yes to indicate natural upper teeth present and also root tips present. From the OHAT, the assessor would advise a referral to an oral health professional since the scoring would be at least a level 1. However, there are daily oral care interventions that should be initiated in order to try to improve the condition of the gum tissue. The brush, mouth tissues, and tongue, AM and PM, would be the standard intervention. When the assessor reviews the OHAT category for dental pain, a consultation with the regular caregiver is required in order to determine what behaviors or barriers are encountered with regard to daily oral care. This is critical information. When the assessor reviews the OHAT category for dental pain, a consultation with the regular caregiver is required in order to determine what behavior or barriers are encountered with regard to daily oral care. This is critical information so that the assessor takes the appropriate steps to ensure the resident is receiving optimal oral care. Assessment of natural teeth and tissue. This slide shows a resident with a single lower tooth and several root tips present. The tooth is undermined by root caries or decay, which makes it very fragile as it could easily break off. Sometimes when teeth break off, they are aspirated, leading to aspiration pneumonia. This would be noted on the diagram of the care plan so that caregivers are aware that the tooth should be cleaned gently and monitored until it is treated by a dentist. Areas with root tips still need to be cleaned with a soft toothbrush twice a day. As with the previous example from the OHAT, the assessor would advise a referral since the scoring would be at least a level 1. However, there are daily oral care interventions that should be initiated in order to try to improve the condition of the gum tissues. Brush, mouth tissues, and tongue, AM and PM, would be the standard intervention. For the OHAT category on dental pain, the assessor should again consult with the regular caregiver to determine what behaviors or barriers are encountered with regard to daily oral care. This is critical information. The diagram under the general section is a particularly valuable tool as it provides an area to record specific concerns such as cuts, canker sores, suspected abscesses, burns, etc. Recording these types of findings will assist daily care providers in monitoring the condition to ensure healing takes place in a timely manner. Assessment of dentures. In this example, the assessor would note under Assessment of Dentures that there is a full upper and partial lower. When dentures are found sitting in a cup during the day, the assessor should always check with the resident and the caregivers to find out if they are not worn and for what reason. If a resident is losing body weight, they are also likely to have changes in their mouth, which will affect the fit of the dentures. Often, a simple repair or reline is all that is required to make them functional, so a referral would be in order. In this case, we will assume that there is no name on either of the dentures, so this would also be indicated on the oral hygiene care plan. Under the interventions for oral hygiene care for the dentures, the assessor would indicate that scrubbing dentures with a denture brush, both AM and PM, is necessary. Also, denture identification is required. Other considerations might be to soak the upper denture in 1 part vinegar and 1 part water to help dissolve the hard deposits. Note that you cannot use this for the lower partial because it has a metal framework. Scrubbing the denture cup and lid weekly with detergent and water is also standard care practice. As mentioned earlier in the presentation, the assessor will need to consult with the care providers who regularly work with the resident to assess the level of assistance required as well as the behaviors. On occasion, the assessor may observe that the state of the resident's mouth is very poor. The regular care provider assumes the resident is independent and capable of doing their own oral care. By reviewing the OHAT findings, the assessor would be able to alert the care provider that a reassessment of the resident's abilities is required. This consultation is also an ideal opportunity to problem solve as regularly observed behaviors are reviewed and discussed. Keep in mind that often oral pain can be exhibited through responsive behaviors, so careful intraoral examination is warranted. Again, an indicator that the OHAT and the oral hygiene care plan are integrally linked. From the review of the behavior and daily care, as well as the results of the oral health assessment, the assessor and care provider should work together to identify the appropriate intervention for each resident. A soft toothbrush should be advised for everyone, as all residents need to have their mouth tissues cleaned. You don't just brush teeth, you also brush gums, tongue, inside cheeks, as well as the roof and floor of the mouth. So even full denture wearers need a toothbrush. A suction toothbrush is usually recommended for residents with dysphagia or swallowing problems. When toothpaste is used, it should be fluoridated, but there are situations where toothpaste is not recommended, such as for those with swallowing disorders or for a resident with dementia who cannot spit it out. Sometimes small specialized brushes are recommended by oral health providers. They should also be providing specific instruction about their use. Dry mouth products are often needed for residents who are on multiple medications where dry mouth is a side effect. Dentures need to be cleaned using a denture brush. Soaking just isn't enough to remove the sticky plaque film. Use denture cleaning paste, but do not use regular toothpaste on dentures as it scratches the acrylic. Acrylic dentures with no metal can be soaked in 1 part white vinegar and 1 part water to help soften hard tartar deposits. Denture cups or boxes must be kept immaculately clean. And dentures should always be identified. There are a wide variety of special care techniques. For more information about these techniques, please review the rest of the presentations in this webinar series.
I would like to thank Donna Bowes for the Series 7 Oral Hygiene Care Plan presentation. I am your facilitator, Mary Lou Vanderhorst, and along with Donna Bowes and Terry Kirkpatrick, our knowledge broker, we invite you to watch one of the other 6 oral healthcare skills web series. Series 1, Denture Care. Series 2, Tools of the Trade. Series 3, Oral Health Assessment. Series 4, Basic Oral Care. Series 5, the 2 toothbrush technique. And Series 6, the infection control. For more information and resources, we recommend that you go to any of the websites listed on pages 2 or 3 of this presentation. Thank you.